coffee story was very topical a couple of years ago. No pun about going off the boil, but it's interesting to see it revisited. So it's a pleasure to introduce Dr. Lucio Mos to address the cardiovascular and metabolic effects of coffee consumption on young hypertensive subjects.
Ladies and gentlemen, the analysis was made in the patients of the HARVEST study. HARVEST study is a prospective cohort study of non-diabetic subjects aged 18 to 14 years with stage 1 hypertension. The patients were 1,200 patients. And the study began in 1990. The controversy still exists about the long-term cardiovascular and metabolic effect of coffee consumption in hypertension. And the aim of this analysis was to assess the predictive capacity of coffee use for cardiovascular events and to ascertain whether the coffee cardiovascular event association was mediated by the long-term effects of coffee on blood pressure and glucose metabolism. The procedures followed were in accordance with institutional guidelines. At baseline, all subjects underwent physical examination, anthropometry, blood chemistry, urine analysis. And participants completed questionnaires about their medical history, family history of hypertension, physical activity, dietary habits, including coffee intake, alcohol use, and cigarette smoking. Clinic blood pressure was the mean of 6 readings obtained during the 2 visits performed 2 weeks apart. Office blood pressure and lifestyle habits were assessed monthly during the first 3 months of follow-up, then after 6 months and every 6 months thereafter. We consider an endpoint when the patient had hypertension needing antihypertensive treatment according to the international guidelines. Among the participants, 26% were abstainers, 63% were moderate coffee drinkers. Moderate coffee drinkers, we intend 1 to 3 cups of espresso coffee. I want to underline that in this part of Italy, all the people drink only espresso coffee, and American coffee and tea are not usual. And the heavy drinkers were about 10%, and these people drink more than 3 cups a day. Heavy coffee drinkers were some older and a higher body mass index. In multivariate Cox analysis, coffee consumption was a significant predictor of development of hypertension needing treatment. And this was more evident for heavy drinkers, but was present also for moderate drinkers compared to abstainers. And coffee was also a predictor of future prediabetes, with other ratio of 2 for heavy drinkers and 1.3 for heavy drinkers. Coffee was also a predictor of cardiovascular event. During a 12.5 years of follow-up, we had 60 cardiovascular events. In multivariable Cox analysis, including other lifestyle factors, age, sex, total cholesterol, 24-hour blood pressure, and the follow-up changes in body weight, both coffee categories were independent predictors of cardiovascular events. both for moderate coffee drinkers and for heavy coffee drinkers. In conclusion, in the result of our study, says that coffee use is linearly associated with increased risk of cardiovascular events in stage 1 hypertension. The effect of coffee on cardiovascular events seems to be at least partially mediated by its long-term effects on blood pressure and glucose metabolism. And take-home message is that we think that coffee consumption should be reduced in young to middle-aged patients with hypertension.
Okay, so thank you for the clarity, and I see